Hello, Adab, Namaste. Burnol, this Burnol basically has been at the center of attraction for a lot of trollers. People have been sending it as a balming ointment for people who've been burnt real bad by online trollers. But this Burnol has a story which goes back a long way, much longer than you and I can even think of. It's a product by Dr. Morpen and it was founded by Mr. KB Suri. And here we have today Mr. Sushil Suri, who's going to tell us more about the story behind how the company was founded and how Burnol and many more products like it, be it your stethoscope, be it your weighing scales, be it your pregnancy kits, glucometer, thermometers, they all came into existence. So in your home, there's a good possibility that there's a Dr. Morpen product lying around. So let's know the history behind this iconic brand, this legendary brand. So today we have with us Mr. Sushil Suri, who's the chairman for Dr. Morpen, and he's also the brother of late Mr. KB Suri. So sir, first up, welcome to the show.
Thank you.
And I would like to go back into the history of how Dr. Morpen was founded. You're all 6 brothers?
We have 5 brothers and 2 sisters.
You're 5 brothers and 2 sisters. And so how did the story roll on? How was this
Look,
founded?
I would say we have a very simple, humble background and as typical as any typical middle class families would have. So as we said that we were 5 brothers and 2 sisters. And
so where do you belong to?
We basically, if we go back to the history, since you use the word history, so we go back to pre-partition days. So we were, we belong from a district called Rawalpindi, now in Pakistan. We moved to India 97, 98, I don't know exactly. So, but we finally settled in a small place called Kalka. That's the border state of Haryana, and that's where Himachal starts.
Right.
And I remember walking down in the evening from Haryana to Himachal every day. So we could say, oh, we are crossing a state. So a small bridge. Now, of course, there are big flyovers coming up. But we were born in Kalka. And of course, there was a small town with typical higher secondary schools, and there was no education there. So we had to move up and down to Chandigarh every day to go to the college. So, and of course, since we were moving up and down to Chandigarh, and so was my elder brother, he studied in MCM Government College for Men for Science Engineering, and I did my medical from DAV. So that we were just together. He was just one year ahead of me, but he started the so-called, I would say, industry. So my father was into the retail business, wholesale earlier than retail. Retail of, I would say, groceries. Very, very simple.
Oh, so basically what you call a grocer, your local grocer, right? Kirana shop.
That's it. That's how it started. And of course, my brother KB Suri, he was very clear that we have a family of 7, and of course, keeping the new generation and things in mind, he was very clear that we can't survive on one shop, and he was very clear, I'm not cut for this. My eldest brother, he was very simple and humble. After graduation, he started sitting in the shop. He was very clear that this is not my future. And now, of course, now since we are talking on the numbers and counts, he was very clear that so many family members and we have to get married and houses and this and that. This is not our future. We need to get out of it and get to the industry. And as traditional parents, they would say, oh my God, how can he do that? We don't have capital. And of course, my dad would always give some, I would say, humble words. We can do this or that. He was very clear. Nothing going to work. We're going to set up an industry. So virtually, I would say with I won't say zero capital. At that time, even 40,000 rupees was nice enough.
It was.
Just with 40,000 rupees.
So which year was that?
It was in 1984.
So
basically, he qualified, he graduated in 81. So 1981. So of course, I got in 82. So 81 to 84, he worked with one of the subsidiaries of Pfizer. Pfizer had a product called ampicillin. So when he looked at the plant and looked at facilities were working for Pfizer, he could see that there's a lot of fat in the system. There are a lot of gaps. So, and he could see that, okay, if we are able to conquer this, so we can certainly run a better industry. And within few months, he started thinking that I'm going to do this. Now, one way you have a first product in India, first time in India, and how can you do that? He slowly learned the tricks of the trade. And while he was still working, he decided, okay, we're going to have this. And he's just waited for 3 years to complete. He put up his resignations. Here you are, and we are in business. So at that time, of course, like I said, there was no capital. So we had one partner who started working with us, and we went to the financial institutions. Now, thanks to Himachal Pradesh Financial Corporation (HPFC) at that time, so we started with a meager loan of 9.4 lakh rupees. 10.4 lakh was the total project cost. And being a scientific person, being a science student, he got a soft loan also for 1 lakh rupees. That's how the humble beginning was. And it started in a rental premise, just I would say 5,000-6,000 square feet. And the guy who had the premises, he was also very, I would say again, gentle. He also wanted to see, look, you're a 21-year-old guy and you want to start a factory, fine, go. I have this site, we can go do a try. That's how it started. But as luck would have it, so the product was really good, ampicillin was really good, and he was an actual floor chemist. He had actually worked on the floor. He was knowing how to make it. He was not a babu or a today's startup guy that, okay, we have to acquire something. He was knowing how to do the production. And I remember during those days that, for example, you go to a bank and take a working capital or whatever. So on Monday morning, you will go to the bank and explain that, okay, this is what we have to do and whatever. Monday evening, you take a small DD from the bank to buy the raw material. He'll take a night train to Delhi.
Okay.
And go to the ministry, get approvals, take the material by end of the day. It was delivered from Rishikesh. So then by Tuesday evening, he'll go again, take a night train, go to the factory, do the production on Wednesday and Thursday, come back to Delhi on Friday morning, sell the material, take 3 times the money, and then go back. And the bank manager said, I have never seen a company or a factory or a person. You take a DD on Monday for say 5 lakh rupees and come back with a DD of 15 lakh rupees on Wednesday or on a Saturday. So this is great. This is how I think this thing started. And it, I would say, motivated all of us from the family perspective. So within 2-3 years, we closed that shop, and I qualified as a CA, as a chartered accountant. Of course, I was helping the factory business and the name of the company and designing and letterhead and then accounts, everything I was involved from day one. But once my CA got completed, so I also started working in a way for the factory as a whole. But slowly, one day I shut the CA shop also. But the whole point was that, okay, now you need business, now you need to spend more time. So I think it was back in '89, and now it's almost, if you count from '89, it is almost, I think, 34 years, so into 100%. Then, but for 2-3 years, there was a struggle. The struggle was to meet the growth, because whatever little capital we had spent in the capex, and now the first product we have was ampicillin, and that's how the name of the company Morpen comes.
Okay. So yeah, I was about to ask you.
Morpen, if you dissect the word, it is Morpen. It is penicillin. More penicillins.
Okay.
So this penicillin, basically, I don't know, you won't remember, but during our childhood, we had seen that penicillin ka injection lagta tha.
Correct.
And that injection, you had to test it.
Yeah,
it was big injection.
It used
you had
to be
test
on the
it.
arm, right?
It has to be tested because there was an allergy from penicillin. So now, great Dr. Morepen, who was a French scientist back in 1894, he synthesized a semi-synthetic penicillin.
Okay.
Penicillin is a biological product. He synthesized a semi-synthetic. That okay, there will be some enzymatic route, and then thereon you can do the chemistry part.
Okay.
So that's how the first product ampicillin was made, and it was named after the name of the scientist, Dr. Morpen.
Okay.
So we choose that name, and hats off to Dr. Morpen now. He may be sitting in heaven and he doesn't know we're selling Burnol under his name. So that's how it is. And that was the first product. But this product had a basic raw material called 6-APA, 6-aminopenicillinic acid. Okay. It was always in short supply. So we could see that till the time we don't produce our own 6-APA, we'll be working 2 days in a week or 3 days in a week. And government encouraged a philosophy, a policy that okay, you want to make your own penicillin 6-APA, you can import penicillin G from China under these licenses, and you'll be given a license. So we got a license for penicillin G, and we started working.
So you used the term API. Can you explain to our viewers what API is? And API also, I've seen that API forms the major crux of your business.
Yep.
So I think we would all want to understand what
That's fine.
API exactly is.
API is basically active pharmaceutical ingredient. When I say,
Okay.
for example, ampicillin. So ampicillin is an active ingredient in a tablet which you buy. That tablet you may not be called ampicillin. That may be called, say Mormox or Morpen, or it may be called Morcin.
Okay.
So now you buy Morcin, but you are buying is a ampicillin.
All right.
So Morcin is the name of the tablet, but the salt is ampicillin.
So for example, Burnol would also have
Burnol
some
has got
other-
different ingredient. Now if you see
Right.
Burnol, so it is important that now you're buying is chlorohexene, gluconate and citramide.
That's the
So these
API
are
in
the
it.
APIs.
Okay.
Then there are excipients. Excipients is like those creams and powder which are which used to deliver it. Every API has got different thing. So now that's what is an API. Now as Morpen, like I said that we started with ampicillin. Slowly we moved to new molecules. Ampicillin was an antibiotic. Then we started another antibiotic, ampicillin, amoxicillin, cloxacillin. So these are all antibiotics. And at one time we said, okay, no more antibiotics. We want to go to new molecules.
Okay.
So new molecules means loratadine, cisapride, ketorolac. These are, you can understand, new means the latest one. Now we have got a basket of almost 40 products, which are APIs.
Right.
So which are naturally not spreading the length and breadth of the word. There are more than 1,000 APIs, active people working. We are focused on the lifestyle.
Okay.
Cardiac, diabetic, neuro. This is the typical, primarily diabetic.
Okay.
Diabetic portfolio we have got a lot. So we have got, for example, sitagliptin, dapagliflozin, linagliptin. So these are all gliflozins and gliptins. There are 10 of them. Then cardiac. In cardiac, for example, all medicine related to the heart. Atorvastatin, rosuvastatin,
I don't
Sartan.
even understand all these terms.
Please don't understand.
I'm so sorry.
Lifestyle. Keep it simple.
Yeah, let's keep it simple.
Keep it simple. Basically, I would say the difference is there are 3 levels. One is antibiotic, which
Yeah.
are typical disease profile. Lifestyle means if you change your lifestyle, you may not have these problems. But if you have diabetic and cardiac, you have to take your
Okay.
medicine the rest of the life. Third is acute or critical condition. For example, the cancers, oncology, vaccine. These are acute.
Right.
Critical care. So we are not into critical care. We are not into antibiotics. We are into mid tier. That's
Okay.
a lifestyle.
So after API, you also diversified into products like glucometers, stethoscopes, and I think you've also got BP monitoring machine
yep.
and things like that. So how did that happen?
I would say it was an interesting journey when we were doing APIs, and you can understand APIs are the basic salts. We were the back end.
Right.
We were not facing the consumer. We were more of a B2B.
Right.
So we wanted to touch base the consumer, and while we were traveling abroad, we are exporting and we are seeing people. We could see the connect there, and of course you would also realize, and of course now India is also opening. You could walk out into any store and you can buy things on your own.
Yes, we
You
can.
go to Walmart, you go to CVS, and you will go to Drug Right, and you can just pick up products. We were always wondering that in India we can't even touch the drugs. So why don't we go to the consumer directly? And when we started looking at the medicines in India, so hundreds or thousands of companies are sitting in doctor's chamber. So everybody is selling the same product to the same doctor with different names, and of course everybody had their own story to tell and their own, I would say, ways to convince the doctors. And of course some would offer hefty discounts, some would offer some schemes, and some people would offer them a foreign tour or whatever. I mean, there's nothing hidden about it. So we could realize that if we keep on doing that, so we end up being maybe 500th in the row.
Right.
Or we could realize when you look after 5-6 years, look at the top brands of India, none of our brands was appearing in the first 10 pages of the book. And of course, I know I was reading those Jack Welch at that time. He was saying if you are number 1 or 2, be there or get out of it. Of course, I had no option to get out, but it's okay,
Right.
fine. I choose a different line that we wanted to be number 1. So where can we be number 1? We could see the consumer forum or the consumer portion is where nobody was focusing.
Okay.
Everybody was sitting in doctor chamber. We said, okay, now we are going to focus on the consumer.
And which year was this?
It was year 98, 99, but we finally launched a brand called Dr. Morpen. That's what that's what is the fancy word today.
Yes.
So Dr. Morpen was a very well planned thought. It's a doctor outside the doctor's chamber. So it
Right.
is still a doctor. It is very friendly and doctor, which is adaptable and it is dynamic. It is vibrant. It's not a a so-called a doctor with a white apron. If you look at our logo, it's orange and blue.
Okay.
So orange gives that life, and blue gives that, I would say, consistency and trust. So there was a lot of debate about that, and there's a wheel of energy. So that energy keeps you in the move. So it was well designed. And now Dr. Morpen, we started with simple products for acidity and for migraine and for pain, body ache. And the second point was prevention. One is cure, one is prevention. In prevention, you have these multivitamins and all those, say, so-called, I would say, let's call it multivitamins only. And now slowly we could see, while again we were looking at the scenario in Asia and Europe, everywhere, medical devices. Everywhere the medical devices are just available off the counter.
Right.
Virtually you can go and pick up a BP monitor or glucometer, put up in your cart. And India, where there was no market like this.
Not in 98.
Yeah, 98, 2000. So at that time we said, okay, now we'll launch medical devices in India. And of course there was no production, and even China was not big at that time. And we started with some European companies, started import and sell.
Import of
medical devices, BP monitors, glucose monitors, weighing scales, thermometers, heating pads. And the first company we started was Burer. But in 5-6 years we could realize that we are basically working for them. So once we establish their brand, one company will say, oh no, you're just a distributor. By the way, we want to fire you next year. So then we switch to the new one, then new one. So in 2-3 years we could realize that, okay, we are working for someone else. Even though we are creating Dr. Morpen as a brand, but Dr. Morpen is selling Burer product, or Dr. Morpen is selling Minarni product.
Right.
So one finds, say, okay, nothing doing. We'll create our own brand. So 2011 onward, we stopped selling third-party brands.
Okay.
Started everything under our own label.
And where was the manufacturing unit?
Manufacturing in 2011 was all Korea and China, but under our own brand.
Okay.
So we got our own specification, our own brand, our own quality control, and that's it. And 2015, once we had enough volumes in 2015, we said, okay, now we need to produce on our own. So 2015, we started our own production, and I'm proud to share we are the single largest producer of glucometers in India, BP monitors in India, and stethoscopes, weighing scales, thermometers. We are not number one in weighing scales and thermometers, but there's a lot of import happening. So when we say glucometer, BP monitor, including import, we are the largest.
Okay.
So now the question may come, okay, by the way, what are other companies doing? They're still busy with the doctors. So we moved out, and now we have created a brand for ourselves in the medical devices. We have created a brand for the OTC. So it has become a household name. Just Google Dr. Morpen, and you will.
We don't even need to Google.
I mean, you'll find
like
10,000
I said,
hits.
Burnol is present in every household, and Dr. Morpen is actually omnipresent. It cannot be missed out.
So that's the beauty. So this is how we have evolved. I think it was a cheerful journey and evolutionary from a B2B to B2C. And from B2C again, I would say it is D2C by these online e-commerce.
Right.
So Dr. Morpen is available online, and I would say even e-pharmacies are available online. So even I would say B2B is trying to get onto the online, but that's an evolution that still remains B2B.
Great.
Interesting journey.
Yes, absolutely interesting. So in that stead, I think manufacturing has been your biggest strength.
Yeah.
And your manufacturing units are also very special. Tell us a little more about it.
Sophia, the way things look in API, particularly this thing, pharmaceuticals, manufacturing is not a number. It's not that, okay, you put up 10 machines, then you start tuck, kal se truck bharne shuru ho jayenge. It doesn't work like that. It's very hardcore technical. One is chemistry is involved, science is involved. Second, quality controls, and then above it is regulators. So everything is highly regulated. What we are supposed to do, not supposed to do. There are guidelines, there are domestic guidelines, there are more international guidelines, and then we file a document. We prepare whatever we do. We prepare something like a product master file. So there's typically called in our industry they call it DMF, drug master file. So for everything we have to make a master file. That's like 500-600 pages, and then we file to the regulator. Okay, this is the product, these are the raw material, these are the reaction, these are the tests, these are the stability data we have done, these are the vendors, these are the approved vendors, these are our team, this is the team biodata. I mean, everything we have to submit to the regulator. And that cannot be changed.
Okay.
If we change anything, we have to submit back.
Oh.
So now, with the grace of God and with all the humility, I would say we have got more than 250 DMFs, drug master files, filed in various regulators all over the world. Most important in US, that's like a reference.
Right.
So that's around 35. Then Europe, then Taiwan, Korea, Japan. All these companies, they come and visit the facilities.
Okay.
So they visit the facility, they approve the facilities. Then there are auditors, customer audit. I won't say 1, 2, there are hundreds of customer audits every year. So customer audit happens, so that's the specialization we have got. And we are privileged today and we are vocal about it, that when FDA comes, they usually have very sarcastic remarks or sometimes very toxic points. But we have been so lucky that the last 3 inspections consecutively in last 5 years, so we have got a nil observation. They call it nil 483. So there have been 0
Congratulations on that.
Thank you, thank you. So that's a landmark we have achieved, and I'm not saying we don't have a license for this, but we got it. And as against this, our counterparts in the industries, they have gone through the same things again. There have been import alerts by the FDA. There have been product recalls. There have been rejections. There have been customer complaints. So there have been all things, because if you do more, certainly there will be. So
Yeah,
maybe
right.
we are small and we are mid-sized. We never got into that problem. So we are happy. So that's one thing which we have acquired in terms of the FDA approval and regulatory strength. Similarly, now in the medical devices, the medical devices was also very unorganized industry. When we started, before that, it was just an import and sell. And for a place like Delhi, you would find in Palika or Chandni Chowk, you will get all these things.
Yes.
These are the imported, smuggled items.
True.
But there was no organized player. Now we have set up manufacturing. It's not the backyard manufacturing. We got ISO 13485 approval, which is done by a British agency. So twice we have been inspected and approved. So we know that we have to maintain a standard. So if we see, so from a evolution point of view, we evolved in the brand and sustainability. Then we evolved in the regulatory steps and the quality standards. So that's what now we have a basket of Morpen.
So, in my understanding,
Yeah.
what I understand is that the pharmaceutical industry has a lot of red tapeism, wherein a lot of regulations need to be met. So, do you think it's a necessary evil, or it sometimes bugs the industry and does not let you perform as well as you could possibly do?
I would say that with due regards to the regulators, regulations are good, or I would say great. We need all these regulations. But question is, do we have the systems to run those things? If, for example, if we talk of US FDA, FDA has got 3,000 PhD graduates. They are taken from the industry. They got, I think, maybe 5,000 inspectors. I do not know the exact numbers. So, but they have got an infrastructure and wherewithal to do it. But when we do it, we just have a paper. Oh, we want to do all these things, but we don't have an infrastructure. Now there, I would say our sympathy is with the government because of the so many norms, because of the so much very low pay scales, and maybe with they don't have the so-called open mind to invite talent from the industry. So they have a very closed mind that okay, you have to have a bureaucrat, secretary, joint secretary, this, that. उसी में उलझे रहते हैं. So that talent input is not there. While industry is evolving, and I'm not saying it's about pharma. Talk of automobile. I mean, the EV has changed everything. You need a different mindset to think about EV. IT, wherever government has changed. So, but the Babu is sitting there. They have a different attitude. I'm not saying there's a mental blockage with them. But question is, they are not skilled to handle that. So once they get skilled, I'm sure the advantage would be there. So we are with the regulator, and we would love to comply with all the regulators. But certainly we would like, I won't use the word relativism, but I would rather say we have to be more open-minded and try to understand. For example, the other day we were discussing in one of those biotechnology calls with government officials that okay, I want to launch something first time in India. What do I do? But when I go to the officer say, foreign ka sample liya. Has it been, which countries has been? No, it has not been approved. I mean, I don't have an answer for that. If it not been approved, I don't have a law.
Right.
The law is that okay, then you go through 20 different things. But if you say, oh, by the way, it has been launched in America, it has been launched in Europe, and India also Dr. Reddy has launched, this is the capsule, this is the tablet, फिर approve हो जाएगा.
So, what's a dream project Do you have a project like that in mind?
We
you
are
would
working
possibly
on
like
some
to
biotech
launch?
projects where we are naturally looking for expedited approvals. So, but certainly there are within India also we have so many things within existing APIs also. But the way the protocols are, so now of course the patent thing has been done very well. Within 6 months to 9 months we get a patent in hand, but that's not a very big thing. But if you want a new molecule to be launched, the protocols are not very well defined. For example, I mean, say clinical trials. Now, clinical trials is very basic. I mean, every country has it, but they have got defined norms. They have got. If you go to US FDA and say, oh, by the way, we want to launch, say, a product on, just as an example, say any neuro disease. So they are ready to discuss. They are open to discuss. Okay, what, why, how. There is a pre-approval meeting. They go with open mind, but because they have I would say a skill committees to discuss. But if I go to our regulator, they got fixed rule book.
So, what does the future of the industry look like to you?
Look, Sophia, pharma industry is, I won't say the future of India. So long as human being would remain, pharma would remain.
Absolutely.
So this is not a dying industry, it's an evolving industry. The future is that yes, within the industry, of course, from India itself, we have $200 billion industry and it is growing globally. It's already crossing $3 trillion. So we are getting into the larger numbers day by day. But within pharma also, I think we need to tread very cautiously, okay, what is growing, what is not growing. From India perspective, I would say India was a generic country so far. Even today, we are a generic country. We got 45% share in the US generic market, which is not small. All over the world, we sell generic medicines, and we are proud to say, oh, we are the pharmacy of the world. But within quotes, it's generic. Now, the future is, can we go to the research? Do we want to be a research company or a research country, R&D country? That's one. I think the future is that we will do R&D in India. And that's what I was talking, all this clinical trial and this and that. We need to evolve.
We will need to evolve.
Yeah. And second, I would say, is a technology point of view. Now we are doing pure pharma chemistry. We are the pharmacy of the world, we are the chemical lab of the world. But we are lacking in the biotech, fermentation biotechnology, and China is quite ahead of us. US and Europe has got much better guideline. So US and Europe have done biotech much smoothly. So we still have to do that. Globally, if we see 70% of the world pharmaceutical market, I would say the drug market, has been swept by the biotech already in value terms. So 70% of your market is already stolen.
Right.
So within 30%, how much can you play? So you need to switch to that
70%.
big basket. So now to do that, you have to establish the protocol, you have to establish the market, you have to establish whatever is required.
Yeah, right.
That's the future way I'm seeing that.
So this is something I think I wanted to know also. COVID was a very difficult time, last 3 years. How did Dr. Morpen work during that time?
We were doing everything, whatever all of our other Indian friends were doing. I think pharma industry was very busy, and I'm not saying about Morpen, everybody was busy. We were a little busier because we were into the OTC also, consumer facing also. So we launched many of those routine things first, the sanitizers and cleaners and all that stuff. Then we worked on vaccines also with the Russian companies for Sputnik vaccine. And then most important was that maintaining the supplies of APIs, maintaining the supply of medical devices, maintaining the supply of formulations. So that was the most difficult task, and rather I would say it was challenging also, and it was adventurous also. And I proudly state that during those 2 years of COVID, we did not close the factory on a single day, except for one day when Modi ji had a call for a full closure. I think shuru, I think it was 20th of March.
Day one, I think.
20th March to 22nd March,
Right.
that's it. After that, no closure. We worked during all COVID times, and all the team successfully did everything, and the numbers were very fancy. We grew our top line by 2.5 to 3 times during those days. So everything went very well. And more interesting was we learned how to work in crisis.
That's very important, I think.
And
That's the biggest test any entrepreneur can have in the career.
we have gone through that test multiple times.
Oh, yes.
But that was interesting. But post-COVID, there was a little lull in the market because people were trying to play with the inventories and this and that. But now the market has revived again.
Okay.
Much better, much happily.
So we wanted to know how many SKUs do you have and what kind of turnover figures are we doing at Dr. Morpen?
Yes, Sophia, I would say that in pharmaceutical, the SKUs are many, so it will be very difficult to give you the number of SKUs. But I would broadly say, from a turnover point of view, we are a $200 million company, give or take 50, 100 crore here. Maybe a 1,500 crores company last year, and this year we'll be closing around $200 million. 60% of the business is pure API, which is the bulk drugs. So there we have around 40 products. So every product may have 5-6 SKUs, maybe 200 SKUs, but I would say 40 products. Then coming to the medical devices. Medical devices has got almost 10 SKUs. Primarily it is 2 SKUs which means more. BP monitors, glucometers, and then you've got weighing scale, thermometers, heating pads, and stethoscopes. But between BP and gluco, that's 80% of our business. 80 to I would say 90% of business. We are the number 1 in glucometers, so that's where it is. And then coming to Dr. Morpen OTC. OTC we have almost 20 products in trade and another 40 products in online. Then we have typical formulation, medical devices, medicines. There are around 40 products again. That's the broad thing. And from a revenue perspective again, 30% is medical devices, 10% is formulation, then 10% is OTC, which is a separate subsidiary. That's broadly, but growing all segments.
Okay. So this was Mr. Sushil Suri for you, and we learned quite a great deal about not just pharma industry, the macro viewpoint of how the industry is working, what the future holds for us, and also how Dr. Morpen is actually doing phenomenally well. Thank you so much for your time.